Hello everybody, and welcome to the Tuesday edition of Video Clips. As usual this week, well, not as usual, it is unusual. I'm going to do 4 video clips and I'm going to spend all 4 of them on addressing coronavirus COVID-19 issues. The newsletter, which went out yesterday, dealt with a couple of issues. It's well referenced, deals with some issues such as the testing methods, which are highly inaccurate, and also how we're categorizing deaths. And I'll cover a little bit of that in a video clip this week, but I'm not going to cover the whole thing. So if you're a subscriber to the newsletter, you got that. And if you're not and you want to be a subscriber, send me an email at pampopper@msn.com. Announcements, careers, and opportunities in the field of healthcare. A lot of people have a lot of time on their hands right now, and so this would be a good time to start an education with us. And if you're interested in that, again, email me. We can set up a time to talk. We are doing some accelerated programs where people will finish earlier, mainly because people have time. I mean, you have to do something with the time you've got on your hands if you're furloughed from work or working from home and it doesn't take all day, which is the case with so many people. So we are going to accelerate the program, not by eliminating any part of the assignments or the classes that are required, but by having the distance between classes and assignments be considerably shorter. And then remember, next week is the mini vaccine course. I think there's no question that a COVID-19 vaccine is coming. The United States government has invested about $1 billion with a couple of drug companies to develop a vaccine. I think there's a high likelihood that there will at least be an effort to make it mandatory. And I think there's a lot about this vaccine business that you need to know about. So the mini course I've made affordable to everybody. It's on Friday, April 24th. And if you're interested in that, also send me an email. And then remember the free stuff that we make available all the time, a free trial membership, so you can try out a couple of our workshops and our articles and recipes and that sort of thing, and decide if you like us enough to form a formal relationship and become a member. So again, pampopper@msn.com. So today for our COVID-19 segment, what I've chosen to do is questions and answers. And the first thing is we are getting hundreds and sometimes thousands of emails every day, people asking us questions about this. And I wish I could respond to each of you individually with references and links and articles and commentary and all that sort of thing, but it's just not practical or possible to do that. So what I try to do is aggregate as much material as I can and then bring answers to you in the newsletter and on these video clips, and it's really the best I can do. So I'm going to try to do that today. I'm going to start with an issue that some of you have brought to my attention. You're concerned because you've seen a video that I posted in early March when the cases and deaths were considerably smaller than they are right now, and the question that you're asking is, does that negate the claims that I've made that we're overreacting? And the first thing I would say is please watch the rest of the videos and also read the newsletter articles, because those progressively have the current numbers. In other words, I'm going to use current numbers as of today on deaths and cases. They have current numbers, and I'm still making the case that the numbers don't really change anything, and I'll show you that in just a second. So do watch those other videos, do read the newsletters, and then I'll try to address it right here. So according to the Centers for Disease Control website, about 9% of the population is affected, the whole world's population is affected by flu annually, with up to 1 billion infections. That's billion with a B, 3 to 5 million severe cases, and 300 to 500,000 deaths per year. It's estimated that 20% of all Americans are affected by this, with 20 to 50 million documented cases, 225,000 hospitalizations, and tens of thousands of deaths annually. Historically, the elderly are the most vulnerable. About 90% of deaths from flu every year are in elderly people, particularly those who have comorbidities like diabetes and hypertension. Now, these data that I've just given you are for what we consider normal years, according to CDC. Now, on April 10th, which was yesterday in the United States, the total number of cases was 459,165, and the total deaths, 16,570. Now, please understand, I'm not minimizing the death of anybody here. I'm just pointing out that it seems like we're having an entirely different reaction to coronavirus than we are to the flu that we have every year. In other words, if 25 to 50 million documented cases doesn't shut down air travel and lock everybody in their houses, how can 459,165 cases do it? And if we're used to tens of thousands of deaths annually, why, when we hit even 5,000 deaths, was everybody locking everything down? This just doesn't make any sense at all. I mean, we're talking about, based on yesterday's data, about 2.5% of the expected infection for seasonal flu. And long before we reached that point, everything was locked down. So I would like for somebody to explain that to me. For the record, one of the things that I've always prided myself in is that I don't have conflicts of interest because I don't take money from people. And so a couple of you have said to me in emails, is it possible that you're all sideways about all these lockdowns and everything because your own business is hurting? Actually, our business is not hurting. We're in the food production business, so we're exempt from that standpoint. But our classes have been offered and our programs have been offered by teleconference and online for the last 10 years. And so nothing really changed here. So my interest in this whole issue is not because I'm being harmed in any way. It's because I'm looking at the devastation around me and I'm very concerned about it. We have close to 800,000 unemployed restaurant workers in this state. I'm concerned about them because they're in significantly world of hurt in terms of economic survival and that sort of thing. We'll talk about that more later in the week. All right, so let's go on to the next topic. And this is, I'm aggregating a whole bunch of questions into this one here, or emails. Sometimes you guys write, lots of times you guys write, and you hear a news report, and this factoid on the news report, it's like proof I'm wrong, okay? Well, how many discrepancies do I need to point out to you, like the data that I just shared with you, before you just start to believe that there's a problem, and you start to think anytime you hear something, maybe you should be just a tiny bit suspicious of it. And so, those of you who know me know that I teach by analogy, and I'm kind of reminded about a friend of mine many years ago who was going through a divorce. And the reason why she had filed for divorce is that her husband had been a serial cheater. She had gone back through his emails, and when she started knowing something was wrong, and developed quite a list of like 6 women that he'd been with. And when she confronted him with it, he insisted that one of the women on the list he'd never been with, and he tried to make quite a to-do about it. But with 6, I don't know what difference one makes. And so I kind of see this whole situation with COVID-19 the same way. There's been so much misinformation. There's been so much exaggeration. I've pointed it out to you, and I'm going to point out a lot of it this week. And so one factoid doesn't change anything. But I think the big issue that I want to focus on, and I'll give you an example, is that the information that we're being fed on the news daily is designed to get people all excited, and it's almost always out of context. So people report to you about hospitals that are overburdened in New York, and there are some, okay? Well, they don't counter that with how many hospitals aren't overburdened or closed. So here's an email that I got from a nurse. For what it may be worth, I'm an ICU nurse at a level 1 trauma center in central Illinois. We're dying. Nurses being sent home left and right. We're not busy at all. A few COVID-19 cases, but that's it. A total overreaction. And we're a major university town with students from all over the world, especially China. Okay, so there's I've said this before, when you put the things that you're hearing into context, you get an entirely different impression. So everything is almost shut down in all states, waiting for this surge, and everybody thinks it's going to be like New York, but it's not like New York. I'll give you another example of the distortion right here in Ohio. On April 7th, Amy Acton, Ohio's Director of Public Health, said convention centers would be used for hospitals if needed. And she made it sound like that might happen pretty soon. Now, as inappropriate as this might seem, I just had all I could do not to laugh when she said it. And the reason is that St. Anne's Hospital is about 5 miles from our office. It's vacant, and the reason we know that is because one of our pregnant associates here goes for her checkups there. The parking lot's empty. There's nobody there. Well, there are 284 beds at St. Anne's that could be used, and then Nationwide Children's Hospital shut down when an employee was found to have coronavirus, and it has 527 beds, and I'm assuming that they've cleaned it all out, and at some point in time they're going to open it up. I can't imagine they closed this multi-billion-dollar facility over one coronavirus case and they're never going to open it again. Well, they have 527 beds. All right, so I looked this up online. Since this whole madness started, there have been 850 or 771 hospitalizations in the whole state. Franklin County has had 850 cases. Now, Amy Acton's own data, she says that 25% of people will need hospitalization. So you take Franklin County, where I live, 850 cases. This means that 212 people would have required hospitalization. Now, if they all showed up on the same day, there are enough rooms in either vacant hospital for them. And I'm just wondering, in what universe does a public health director suggest that we're going to put people who are sick at the convention center instead of taking them to hospitals that are vacant a couple, 3 miles away and equipped for sick people? This just doesn't make any sense. So the only thing that I can think of is it must have been done for show and to induce panic. So start thinking when you see something that there probably is another side to the story, and then check it out. And if you find something interesting, report it to me. A lot of you guys are sending me great stuff that I've been able to check out and document, which I'm using in articles and in these video clips too. All right, so on to the next question. African Americans seem to me be more profoundly affected. Is this true, and is this possible? It's possible. I don't know. I haven't looked at the data, but I'll remind you that it is not uncommon for certain ethnicities to be disproportionately affected by many things. So, for example, African Americans are more likely to develop hypertension and type 2 diabetes also. So it's not out of the realm of possibility that ethnic groups could suffer from this differently from one another. And of course, one of the most common inquiries that I get is, what do you make of Italy? Because it was so disastrous there. And I talked about this last week. John Ioannidis, who is a Stanford University medical doctor, who's been talking much in the same way that I have about the overreaction and the danger of overreaction, talked about that. And I've looked at government data from Italy as well. So the thing to keep in mind when you're looking at Italy is it goes back to this context issue. So demographics, most elderly population in Europe. And so it's going to be worse there than it is someplace else. Most of the people had underlying diseases. There's a strong history in this population of smoking, COPD, and CHD, all risk factors for death from flu. Many of these people had limited life expectancy even if they had never become infected. And then the Italian government has basically said that they're not really sure how many of these people died with versus of coronavirus. And we're going to talk about that in a future video clip this week because that's an important issue. There are some other things that were wrong in Italy that led to what I think is a perfect storm. The low number of ICU beds, a third per capita of the rate in the United States. The system is at full capacity every winter because of the flu in Italy, and anything extra would just throw it into a tailspin. 25 to 30% increase in deaths in Italy in the winter. Seasonal flu is the reason. Italian doctors overreacted. In other words, much the same thing happened there that's happening here that I'm cautioning about, which is the overreaction, the panic, and that sort of thing that has caused people to do things that in rational times they would never do. So doctors overreacted. They admitted too many people to the hospital who didn't qualify. And then when the really severely ill people started showing up, there was a problem. There was nothing done to protect healthcare workers or test them in any way. There were 3,000 healthcare workers in Italy that had to go home and be quarantined, and that really put a burden on the system too. The other thing about context is that, and Ioannidis talked about this in several different interviews and articles, is the fact that when you see the disastrous state of Italy on these news stations and that sort of thing, the view that's given is that what you're seeing is going on in the entire country, and the disaster actually affected a pretty small area. Now, there's another collateral damage disaster that's happening that you can read about online, and that is that the mafia has taken this advantage, has taken this opportunity now that the country is in such chaos to accelerate their activities. And there is more mob activity in Italy than there has been in a long time. And that's one of the reasons why I think we should be very cautious, and things should have been done differently and a lot more deliberately and with a lot more thought. All right, here's a very good question, I think, that many of you have asked. Well, Pam, you're criticizing everybody and saying they did the wrong things, so what the heck would you have done? And that's a good question. I think that a lot of things need to be done, but I'll tell you what my top priorities would have been if somebody had asked me. I think, first of all, we know who the vulnerable people are. They're elderly people with comorbidities and people of any age who are immunocompromised for any reason. Children and adults getting chemotherapy for cancer, for example, or autoimmune patients taking immunosuppressant drugs. We know who those people are, and particularly the elderly ones who are confined to home care or nursing homes. And I think the first thing I would have done had I been in charge, which I'm sure would never happen, but I would have made sure that any healthcare worker interacting with those people was tested, and that there would be some system, maybe even healthcare workers moving into these facilities so as to avoid contact with family members and kids and people who could give them the virus. Lockdown for healthcare workers of a certain type dealing with a certain type of population. I think that might have been important. I think another thing would have been to develop very detailed instructions for the immunocompromised and recruit a task force and a lot of volunteers who could have left food packages on porches and things of that nature. All this effort, I've said for a long time, all this effort spent keeping me out of the library and not letting people go buy shoes, I think could have been invested entirely differently and more productively. No panic. The fact that the health departments and the various people involved in this have ginned up the panic is maybe the most concerning of all, because panic is a known problem. And I'm going to share with you later this week the health professionals' comments about this type of panic and anxiety that this has all generated, and it didn't need to be that way. In other words, in the case of a big problem, the best thing to do is keep everybody calm. I mean, just think about the disaster movies you've watched on television. When the building's on fire, Bruce Willis doesn't go around screaming at everybody. He's cool, calm, collected, tells everybody it's going to be okay. Let's get organized. We can get out of here. I mean, it's always the cool, calm person who saves the day, not the person screaming and hollering like their head's been cut off, right? And then honest reporting. I think the dishonest reporting, and I have some of that to share with you, both in the newsletter yesterday, I shared some of it, and I'll share a little bit of it on video clips. Just outright lying, and that is unconscionable. And we should be using data to drive decisions. And as it turns out, very good data was available, and the data that we had could have led to entirely different decisions than this mess in which we find ourselves now. Last question. Some of you have said, Pam, you are way out of your wheelhouse on this. You should go back to talking about diet and lifestyle. Well, I do talk a lot about diet and lifestyle, but I've made it crystal clear since I started my career that I think that a myopic focus on diet causes one to be a reductionist in a different sort of way. I mean, when I got involved in all of this, one of the things that I realized is that what's wrong with our healthcare system and what's wrong with the people who have to interact with it is, yes, they're not being told that they should eat better. They're not being told they should exercise. They're not supported in doing those kinds of things. I agree. But the problem is bigger than that, because if you watch every morsel you put in your mouth, but you sign up for a cancer treatment that causes side effects that might kill you early, I don't think that's a good outcome. And if you're sitting at home right now, hiding in the basement with vegetables because of all this nonsense you see on television, I don't see how. I look at the big issue here being this incredible mess that has been created by, I think, some unscrupulous people. I think some people got swept up in it that didn't intend to do bad things. I think there were some people who intended to do bad things behind this too. But I think that's the story. I think that's the thing people need to know about. I've been advising people for 25 years that, and I'm not the only person, John Ioannidis, I mean, the Choosing Wisely campaign involved 80 specialties putting together lists of things that they believe their people shouldn't do anymore or do less of. 800 different strategies. So the excesses of medicine I've been talking about for 25 years as being the most dangerous thing to our population. And the recklessness and excesses of medicine, what we're seeing right now, is all that on steroids. And I think it's actually the thing to pay attention to. We can talk about how to build your immune system when this is all over, but right now I don't see what's going on as being helpful to anybody's immune system or any other aspect of their health. So that's why I'm not getting on YouTube every day and talking about vegetables. That's not the story that is most adversely affecting people's health at this time. So that's the Q&A. I could have gone on for another 2 hours, and some of you probably would have lost interest. And I'll answer more. But I wanted to address these kinds of comments, which are, which I got a lot of the same things. So I thought I would just address it here. All right. Well, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. I'll be back to you tomorrow with some more news. Thank you so much for watching.